Next, we're going to talk about faith community nursing. Faith community nurses work with individuals, families, and faith services and faith communities to coordinate programs and help for patients regarding health and wellness and wholeness. We're balancing knowledge and skill to facilitate the faith community as it becomes a caring place. So we're establishing the faith place that people already come to as a place that they can also receive spiritual and physical care as well. And we look at specific health concerns of people at the individual, family, and the group level. So we have a long association of nursing with faith communities, and in 1984 parish nursing was introduced. So to be a parish nurse, you need to, or a faith nurse, you have to be a registered nurse in your state. You need to have a baccalaureate or higher because generally you don't receive community education in the associate degree program. You need to do some foundational work in community and faith nursing. So there are specific coursework that you can take in faith nursing. There are different faith learning centers that provide that education. You can find it online and in specific places. You need to have a knowledge of spiritual beliefs so that you can reach out to the people in your community. And you need to be very self-sufficient. You need to be self-motivated. You need to be engaged. And you also have to be very flexible because plans change. And so you're adding a spiritual dimension to your care and practice. You're looking at how spirituality impacts your patient and what it means to them and what it means to your congregation and the people that you're working with. We want to provide a balance of theology and humanities. So we want to look at the healthcare system. We want to look at the things that we know that are effective in care and our modern care medicine, complementary and so forth, and other practices, and then also include faith. So parish nurses look at the strengths of individuals, families, and the community. And all of this is considered an ongoing dynamic process. So you never get to the point where everybody's fine and you leave them alone, because everyone has continuing needs. And so you're going to incorporate faith and healing together and provide care. You also collaborate with other health ministries that you need to. You do a lot of referrals in faith ministry. You're not necessarily providing direct patient care, but you may be helping that person obtain resources, and they may need to find a new provider. They may need other services that you're aware of that they're not aware of. So you need to have a good list of all the different community resources that are available that your congregation can use. You also have to have an active nursing license. You have to follow the State Nursing Practice Act. Many states now have some specific language in the Nurse Practice Act about parish or faith nursing, and so you want to read that and be sure you follow it. You also want to be following the American Nurse Association Code of Ethics, and then provide the appropriate documentation. You may not be in a practice area where you have your electronic health record, but you still need to maintain records of what you're doing. You're going to be accountable to whoever sponsors your particular faith nursing practice. And you may have a very limited or a highly defined budget, which is another way of saying there's not a lot around. And so you may need to garner other resources, look for grants and for other agencies that are willing to support you. And make sure that you never start a project that you do not have full resources and funding for, because that can be very disappointing and can cause a lack of trust if you have to stop offering something that you had promised. Credentialing, there is a faith nurse credential that you can actually get, and some places require it, some it is voluntarily. If this is an area you want to work in and you have 1,000 hours of practice in that area within the last 3 years, I highly recommend that you do your certification. It's always great to be certified in whatever you're doing. And so next we're going to move on to occupational health nursing.